Welcome to the Deep Dive. We're here to give you the essential knowledge, fast. Today, we're diving into the thyroid blood test.
That's right.
And this deep dive is really focused on the benefits of getting checked and, crucially, information on local access for testing using info from Blood Test UK, specifically for Stevenage residents.
Yeah, that local angle is important. And the thyroid itself, well, think of it as your body's energy regulator. It's a small gland, sure, but it uses hormones, mainly T4 and T3, to control your metabolism.
Metabolism, so like energy levels, heart rate.
Exactly. Heart rate, mood, how warm you feel. It touches almost everything. If it's off balance even a little, your whole system can feel sluggish or out of whack.
Okay, let's unpack this then. Why is the test sometimes confusing? It measures TSH, right? Thyroid-stimulating hormone, which comes from the brain, not the thyroid itself. So if TSH is high, that means your brain is like shouting at your thyroid to work harder.
Precisely. It means the brain thinks the thyroid isn't producing enough hormone. So high TSH usually points towards an underactive thyroid, which is hypothyroidism.
And low TSH would suggest the opposite, maybe hyperthyroidism, too much hormone.
You got it. It's checking for that balance. Is there too little or too much thyroid hormone floating around?
And finding that balance early, the source material from Blood Test UK really stresses this, has huge long-term benefits.
Oh, absolutely huge. If you leave thyroid issues untreated, you're looking at potentially severe chronic fatigue, the kind that doesn't just go away with sleep.
Right.
And major weight changes, up or down, that you can't explain. Plus, serious risks down the road, heart problems, and even cognitive issues like persistent brain fog or memory trouble.
So those key symptoms to watch for. If you're feeling constantly wiped out for no reason, if your weight has suddenly shifted drastically, or if your mood's been really low or erratic, that's a flag.
Definitely a flag. Worth talking to your doctor about testing for sure.
And once something is found, it's not just a one-off test, is it?
No, not at all. Regular monitoring is crucial. So say you have low thyroid function, hypothyroidism, you might be prescribed levothyroxine.
Which is?
It's basically just synthetic T4 hormone. It replaces what your body isn't making enough of. But getting the dose right requires ongoing checks. Your doctor needs to monitor your levels to keep you stable and prevent those complications we talked about.
And this brings us back to the local access point. Because knowing where to go makes taking that first step or getting those regular checks so much easier. This info from Blood Test UK is specifically for people in Stevenage.
Yeah, it's very practical. It doesn't just say see your GP. It mentions, for example, routine checks can be done at GP surgeries like Lister Medical Center or Kingfisher Practice.
Okay, specific names.
Exactly. And if you need more specialized tests, maybe your GP refers you, those can often be done through Lister Hospital. And then there's also mention of private options for, maybe quicker access, like the Stevenage Diagnostic Center.
That's brilliant. Having those actual place names just removes a huge barrier, where to call, where to look into. It makes being proactive feel achievable.
It really does. And beyond the test, the source connects this to things you can do yourself, lifestyle choices.
Like diet.
Diet is important. Your thyroid needs certain nutrients to work properly. Think iodine, you find that in seafood, dairy, seaweed. And selenium, which is readily available in things like Brazil nuts. Just a couple a day can make a difference.
Simple things. But Blood Test UK also highlights stress management, yoga, deep breathing.
Yeah.
Why is stress such a big deal for thyroid function? It feels less direct than nutrients.
But it has a very direct biochemical effect. Chronic stress means your body releases a lot of cortisol, the stress hormone.
Okay.
And high cortisol levels can actually interfere with the conversion of T4, the storage hormone, into T3, which is the active hormone your cells use.
So even if your T4 level looks okay on a test.
Exactly. If you're chronically stressed, your body might not be using that T4 effectively because the conversion to T3 is blocked or slowed down. So managing stress isn't just good for your mental health, it directly impacts your thyroid hormone activity.
That makes so much sense.
So if we connect this to the bigger picture, being informed about what TSH and T4 mean, knowing the symptoms, understanding these lifestyle links, it empowers you.
Right, you can have a much better conversation with your doctor.
Definitely. You can discuss your results, understand why they might suggest, say, an ultrasound to look at the thyroid gland itself, or other follow-up steps.
So wrapping this up, the key takeaway really is that knowing where to get tested locally, like the specific options in Stevenage highlighted by Blood Test UK, is a vital shortcut. It helps you maintain energy, understand your body, and avoid those serious long-term problems.
It really does. And maybe a final thought. Remember that a single test result is just a snapshot in time. Things like chronic poor sleep or high stress levels that you might just be pushing through can influence those numbers.
Interesting.
So thinking about your overall well-being, maybe ask yourself, what's one small, manageable, stress-reducing change you could realistically make this week to support your health?
That's a fantastic challenge to leave folks with. Use this knowledge, take that proactive step. Thanks for joining us on The Deep Dive. We'll see you next time.